Hello, everyone. Today we gather to shed light on a pervasive issue affecting millions worldwide: headaches, migraines, and chronic tension. My name is Dr. Rod Justice. My goal today is to arm you with knowledge, to empower you with insights into the types, triggers, and effective management strategies for headaches and migraines, with a special focus on the role chiropractic care plays in providing solutions. By the end of this presentation, you'll have a deeper understanding of those conditions and how chiropractic care can offer relief and improve your overall well-being. Headaches and migraines are not merely occasional discomforts. They're debilitating conditions that can significantly impact one's quality of life. The impact of these conditions goes way beyond the physical. Headaches impede our ability to function optimally, affecting work, relationships, and overall quality of life. It's crucial to understand their prevalence and the challenges they pose to individuals across all walks of life. So let me help you understand headaches, migraines, and chronic tension. So let's take some time to better understand the different types of primary headaches. Primary headaches occur when the pain in your head is the condition. These headaches aren't triggered by something else that your body is dealing with. Tension headaches typically present as a dull, aching pain around the head, often caused by muscle tension and stress. Migraines, on the other hand, are much more complex, characterized by intense throbbing pain, often accompanied by nausea, sensitivity to light and sound, and sometimes visual disturbances. Cluster headaches are characterized by frequently recurring, up to several times a day, brief but extremely severe headaches, usually focused in or around one eye. Chronic tension headaches are persistent and unremitting headaches that are more disabling than episodic tension headaches. So let's look at tension headaches. The most common type of headache, they're characterized by a dull, aching pain or a pressure sensation that typically affects both sides of your head. It's often described as like it feels like your head's in a vice, or there's a tight band wrapped around your head. Sometimes it spreads into or from the neck. It might be stress-related or associated with neurological problems in the neck. They can last anywhere from 30 minutes to several days. They can occur on 15 or more days a month for at least 3 months. Now, there's two types of migraine headaches, aura versus non-aura. Aura migraines are those accompanied by pre-headache symptoms like flashes of light, blind spots, or tingling sensations. Non-aura migraines, also known as common migraines, don't have these pre-headache symptoms. The symptoms and patterns usually involve throbbing or pulsing pain, often on one side of the head, though it can affect both sides. Other symptoms may include nausea, vomiting, dizziness, and sensitivity to light, sound, and odors, and these things usually last for 4 to 72 hours. Cluster headaches might happen with severe burning and piercing pain. They usually happen around behind one eye or on one side of the face at a time, and they can be accompanied by swelling, redness, flushing, sweating, nasal congestion, and eye tearing on the same side as the headache. They usually occur in a series, and each one can last between 15 minutes to 3 hours. During a cluster, people may experience a headache anywhere from 1 every other day to 8 per day. A series of clusters can be daily for months at a time. Now, chronic tension headaches are a persistent dull ache or pressure sensation around the head. They usually happen 15 or more days during a month for at least 3 months. The pain may be continuous or fluctuate in intensity over time, leading to chronic discomfort and disability. Now, chronic versus episodic tension. Episodic tension headaches occur less frequently, typically less than 15 days a month, and may be triggered by specific events or circumstances, such as periods of increased stress or muscle tension. Chronic tension headaches are more persistent and may become a constant presence in an individual's life, significantly impacting their daily functioning and quality of life. So let's look at the numbers on headaches. Globally, headache disorders affect approximately 40% of the population, or 3.2 billion people, in 2024. Generally, headaches are more common in females than in males. Headaches are among the top 3 neurological conditions for most age groups, starting with age 5 and remaining in the top 3 until the age of 80. Headache disorders were found to be a third highest cause of disability-adjusted life years worldwide after stroke and dementia. Migraine is the leading cause of work days lost due to disability in the world among people less than 50 years old. Worldwide, only a minority of people with headache disorders are appropriately diagnosed and treated by a healthcare provider. Secondary headaches are a symptom of something else that's going on in your body. If the trigger of your secondary headache is ongoing, your headaches can become chronic. Let's review different types of secondary headaches and some characteristics of each one. Medication overuse headache or rebound headache is the most common secondary headache disorder. It's caused by chronic and excessive use of over-the-counter medications to treat headaches. This type of headache is more likely to occur anytime over-the-counter pain medications are used more than 15 days of a month. Allergy or sinus headaches sometimes happen as a result of an allergic reaction. The pain from these headaches is often focused around the sinuses or front of the head and face. People with chronic seasonal allergies or sinusitis are very susceptible to these. Hormone headaches are related to the menstrual cycle and fluctuating hormone levels. Menstruation, birth control medications, and pregnancy can all affect estrogen levels and cause headaches. Caffeine affects blood flow to the brain, and overconsumption can cause headaches. Also, exposing your brain to large amounts of caffeine on a regular basis can change your brain chemistry. Withdrawal from caffeine when your brain is used to the stimulating effects can cause headaches as well. High blood pressure can cause headaches. These headaches usually occur on both sides of the head, are typically worse with any activity, and have a pulsating quality. In most cases, hypertension doesn't cause headaches. So if you experience this kind of headache, it should be treated as a medical emergency, as your blood pressure can become dangerously high, 180 over 120 or higher. Post-traumatic headaches can develop after a head injury. These headaches may feel like tension headaches or migraine episodes, and they usually last up to 6 to 12 months after the head injury occurs. Spinal headaches result from lumbar punctures that lower cerebrospinal fluid pressure. Research estimates that spinal headaches follow a lumbar puncture anywhere between 10 and 40% of the time. Spinal headaches can occur in the forehead, temples, upper neck, and back of the head, and they typically worsen when you're upright and improve when you lie down. Exertion headaches can happen quickly after periods of intense physical activity. Activities like running, weightlifting, etc. can cause increased blood flow to the skull, leading to a throbbing headache on both sides of the head. These headaches shouldn't last too long and usually resolve within a few minutes to several hours. Here's a picture of where we can usually expect different types of primary and secondary headaches to cause head pain. It's likely that all of us will experience headache during our lifetime. Since there's many different types of headaches and many different secondary causes, this explains why the condition is so common. Most headaches have more than one contributing factor. Some of the more common triggers for headache are lifestyle related, including diet, stress, muscle tension, environmental factors, and postural and ergonomic issues. Tension headaches result from muscle tension and stress. Prolonged periods of poor posture, excessive stress, anxiety, or overuse of certain muscles in the head and neck region can trigger or exacerbate tension headaches. Additionally, factors such as eye strain, fatigue, dehydration, and lack of sleep can contribute to their onset. Migraines can be triggered by the variety of factors, including hormonal changes, certain foods or food additives, dehydration, changes in sleep patterns, stress, environmental factors, and sensory stimuli. Many individuals experience prodrome symptoms such as mood changes, food cravings, neck stiffness, and increased urination hours to days before the onset of a migraine attack. Contributing factors for chronic tension headaches may include prolonged periods of stress, poor posture, inadequate sleep, or underlying neurological issues. Over time, the persistent pain and discomfort associated with headache disorders can have a significant long-term effects on an individual's physical and emotional well-being, leading to an impaired quality of life and increased reliance on pain medications or other interventions for symptom management. Migraines and other headaches can also affect people's ability to work through decreased productivity and interpersonal relationships. Often people continue to try to work despite the debilitating symptoms that can occur. Headache-related productivity loss may affect people's careers and/or security, financial situation, relationships, and mental health. It also causes economic loss to companies and society. Addressing the underlying causes of implementing appropriate treatment strategies is essential for managing chronic headaches and improving overall quality of life. So how do we take control of headaches? They've historically been underestimated, underrecognized, and undertreated throughout the world. Poor awareness is prevalent in the general public. Headache disorders are not perceived by the public as serious since they're mostly episodic, do not cause death, and are not contagious. The low consultation rates in developed countries may indicate that many affected people are just unaware that effective treatments exist. Half of people with headache disorders are estimated to be self-treating. Many of those troubled by headaches do not receive effective diagnosis and care. Now, appropriate treatment of headache disorders requires accurate diagnosis and recognition of the conditions, patient education, appropriate treatment with cost-effective methods, and lifestyle modifications. Your doctor can begin the diagnosis process with a physical exam and health history. Keeping a headache journal with the duration, intensity, location, and possible triggers can be very helpful to your healthcare provider. Once your doctor reviews your medical and headache history and conducts physical and neurological exams, lab screening and diagnostic tests may be ordered to either rule out or identify conditions that might be the cause of your headaches. So now let's discuss some lifestyle modifications and self-care practices that are effective in headache management. Stress management techniques. Stress is a common trigger for headaches, migraines, and chronic tension. Implementing stress management techniques such as mindfulness meditation, progressive muscle relaxation, yoga, tai chi, or deep breathing exercises can help reduce stress levels and alleviate headache symptoms. Engaging in regular physical activity, spending time in nature, and practicing hobbies or activities that bring joy and relaxation can also contribute to stress reduction. Diet and hydration recommendations. Maintaining a balanced diet and staying hydrated are essential for overall health and can play a significant role in managing headaches and migraines. Certain dietary factors such as skipping meals, consuming caffeine or alcohol in excess, or eating foods high in sugar, salt, or additives can trigger headaches or migraines in some individuals. Keeping a food diary to identify potential triggers and adopting a nutritious diet rich in fruits, vegetables, whole grains, and lean proteins can help reduce the frequency and severity of headaches. Additionally, staying well hydrated by drinking plenty of water throughout the day can help prevent dehydration, a common headache trigger. Exercise and movement strategies. Regular physical activity has been shown to be beneficial for reducing the frequency and severity of headaches and migraines. Exercise helps improve circulation, reduce muscle tension, and promote relaxation, all of which can contribute to headache relief. Engaging in activities such as walking, swimming, cycling, yoga, or Pilates for at least 30 minutes most days of the week can be beneficial. However, it's important to listen to your body and choose activities that are enjoyable and suitable for your fitness level. Ergonomic adjustments for posture. Poor posture, especially when sitting or standing for extended periods, can contribute to muscle tension and headache development. Making ergonomic adjustments to your workspace or daily activities can help improve posture and reduce strain on the neck, shoulders, and upper back. This may include using ergonomic chairs and desks, maintaining neutral spinal alignment, taking regular breaks to stretch and move, and using supportive cushions or pillows as needed. Behavioral therapies have also proven to be effective in managing headache disorders and many of the contributing factors of headaches. Cognitive behavioral therapy is a type of psychotherapy that focuses on identifying and changing negative thought patterns and behaviors that contribute to stress, anxiety, and pain. Relaxation techniques such as meditation, deep breathing, progressive muscle relaxation, and guided imagery can help promote relaxation, reduce muscle tension, and alleviate headache symptoms. Biofeedback is a technique where it helps individuals learn to control physiological processes such as heart rate, muscle tension, and skin temperature through feedback from specialized monitoring devices. Now let's discuss the role that chiropractic can play in headache prevention and management. There's three major elements to the effective treatment of headaches through chiropractic: spinal adjustments and alignment, patient education, and posture-correcting exercises and stretches. Spinal adjustments and alignment. Chiropractic care involves spinal adjustments. These techniques aim to improve spinal alignment, mobility, and overall nervous system function, thereby alleviating tension and pressure on the nerves and surrounding tissue. By correcting the misalignments or subluxations in the spine, particularly in the neck, chiropractors help reduce headache and migraine frequency, severity, and duration. By optimizing the function of the entire nervous system, chiropractic adjustments play a crucial role in alleviating many of the triggers and contributing factors that are sourced in our own bodies. Patient education. As a chiropractor, one of the core values in my office is education. These workshops, our daily conversations during your care, and home materials that I have dedicated much time and energy to provide for you are ultimately geared at arming you with the knowledge and tools necessary to aid in your optimal health and well-being. Chiropractic education can help you discover your personal headache triggers and contributing factors, as well as finding constructive ways to break habits and practices that are making your headaches more prevalent or difficult to manage. Corrective exercises and stretches. As your chiropractor, I will often prescribe corrective exercises and stretches to help patients improve posture, strengthen weak muscles, restore balance and mobility to the spine and surrounding structures. These exercises may target areas of muscular imbalance or weakness that contribute to poor posture and spinal misalignments, leading to tension headaches and migraines. By incorporating corrective exercises and stretches into treatment plans, chiropractic can support long-term headache prevention and management. Now let's look at some practical tips for headache prevention and management. So you knew this was coming, right? Regular chiropractic care can play a vital role in preventing and managing headaches by promoting spinal health, reducing tension, and addressing underlying neurological issues that contribute to headache development. Incorporating chiropractic adjustments into your wellness routine can help maintain spinal alignment, improve posture, and enhance overall well-being. By scheduling regular chiropractic visits, individuals can proactively address any spinal misalignments or muscle imbalances before they manifest as headaches or migraines. Regular chiropractic care can play a vital role in preventing and managing headaches by promoting spinal health, reducing tension, and addressing underlying neurological issues that contribute to headache development. Incorporating chiropractic adjustments into your wellness routine can help maintain spinal alignment, improve posture, and enhance overall well-being. By scheduling regular chiropractic visits, individuals can proactively address any spinal misalignments or muscle imbalances before they manifest as headaches or migraines. So let's look at the top vertebra, the atlas. In the picture on the left, the atlas is that first bone under the skull. Now notice that going up each side of the spine is the vertebral arteries. These are one of the major blood supplies to the brain. When the atlas is in place, there's a bit of slack in the arteries. This allows for a smooth flow of blood into the brain. In the picture on the right, the atlas is out of place. Now look at those vertebral arteries. The one on the left is stretched, and this will definitely restrict the flow of blood to the brain. This is why I check your atlas alignment on each visit, and if it's out of place, I use the instrument to put it back in. Keeping that bone in place is absolutely necessary for your brain to get a good blood supply and give you a better chance of staying headache-free. Maintaining good posture and ergonomic habits can help prevent tension headaches and reduce strain on the neck, shoulders, and upper back. Tips for maintaining good posture and ergonomic habits include sitting ergonomics. Sit up straight with your shoulders relaxed and your feet flat on the floor. Use an ergonomic chair with good lumbar support and adjust the height and angle of your computer monitor to avoid straining your neck. Standing ergonomics. When standing, distribute your weight evenly between both feet and avoid slouching or leaning forward. Use a standing desk or adjustable workstation to alternate between sitting and standing throughout the day. Lifting techniques. Use proper lifting techniques to avoid straining your back and neck muscles. Bend your knees and keep your back straight when lifting heavy objects, and avoid twisting or jerking motions. Sleep ergonomics. Use a supportive mattress and pillow that promote neutral spine alignment while sleeping. Avoid sleeping on your stomach, as this can strain your neck and contribute to headaches. Stress reduction techniques can help manage tension and prevent stress-related headaches. Strategies for stress reduction include mindfulness meditation. Practice mindfulness meditation to cultivate present moment awareness and reduce stress levels. Deep breathing exercises. Engage in deep breathing exercises to activate the body's relaxation response and promote feelings of calmness. Progressive muscle relaxation. Practice progressive muscle relaxation to systematically tense and relax different muscle groups in the body, reducing overall tension and promoting relaxation. Yoga and Tai Chi. Participate in yoga or Tai Chi classes to improve flexibility, reduce muscle tension, and promote relaxation through gentle stretching and movement. Collaborative approaches with other healthcare providers. This integrated approach may include a combination of chiropractic care, physical therapy, behavioral therapy, and lifestyle modifications to address the underlying causes of headaches and migraines and promote long-term relief and wellness. From the bottom of my heart, I'd like to thank you each one for taking the time to watch this presentation. I hope you've learned from it. And, at some point, somebody told you about chiropractic. Now it's your turn to pass on the favor. We've got vouchers available to help you save your friends $1,200. on the care program, please ask us for those, pick those up, give them to your friends, and refer them in. We're always looking to help more people. That's why we're here. Thank you. Appreciate it.